Got some good news this morning. Bryce Ambergy's son Luke is out of the hospital, I believe, and staying at the Ronald McDonald House with his parents in Cincinnati. So our prayers have been answered. I want to thank the committee. Bryce is he is the head of the committee, and he's been gone, and we're glad that he is gone because he has to take care of his son. But the committee staff has had to fill in and do double time, and we certainly want to thank them for doing that, and we're thankful that our prayers for Luke have been answered. Do any members have any introductions they would like to make? Madam Secretary, call the roll.
Senator Adams, Senator Douglas,
Present.
Senator Harper Angel, Senator Higdon, Senator Howell, Senator Mays Bledsoe, Senator McDaniel, Senator Nemus,
Present.
Senator Thayer,
Here.
Senator Thomas, Chairman Schickel.
Present. We do have a quorum and are duly constituted to do business. We are going to go out of order on the agenda and take House Bill 62 first because I don't anticipate that taking very long. Mr. Speaker, it's good to have you here. Introduce yourself for the record. I know we've heard this during the interim, and I do appreciate that, so I think it's been well vetted. And introduce yourself for the record and proceed with your testimony.
Well, thank you, Mr. Chairman and members of the committee. My name is David Mead. I'm the Speaker Pro Tem of the House, and we have the Kentucky Realtors President, Elizabeth Monarch, with us as well this morning at the table. What this is, House Bill 62, is what we call the wholesaling bill. This bill simply is taking wholesalers and saying if you're going to advertise a property that you don't own, but you have put down a contract on something like that, then you are going to be licensed as a real estate agent. And the reason for that is because now I'm not going to say that all wholesalers are doing anything incorrectly. Some do this properly, but many don't. And what they do is, for example, I had an instance here a while back where these wholesalers were contacting folks who don't know the market, primarily older folks in our communities, talking to them about their properties. And a lot of times they'll use PVA values because we know they're less a lot of times than what the actual value of property is. It says, hey, PVA value says your property's worth $50,000. I'll give you $60 for it, knowing it's worth $160,000 or whatever it may be. And they get a contract on that property. They never intend to take possession of that property. They then try to sell the property to somebody else or the contract to someone else and try to bank off of that equity that that person has in that home. It leaves them in a bad place. It also loses that equity that they had. And it's basically just a predatory practice to take advantage of those who don't know the market. And so by making them licensed real estate agents, they're doing the same job as a real estate agent, but now this puts them under the fiduciary duty that an agent has. They have to give their seller the absolute best service. They have to try to get the most money for it and treat them fairly. So that's how we're trying to solve that problem. This, again, does not touch for sale by owners. It does not touch it if you are flipping properties, if you're taking possession of those properties and flipping them for commercial purposes. It is simply if you are trying to get those contracts so that you can advertise that property and then try to make money off of that equity in that person's property. But that's basically what the bill does.
Thank you. Would your guest like to introduce yourself for the record and make a few comments?
Yes, sir. Thank you, Chairman. My name is Elizabeth Monarch. I'm the Kentucky Realtors current state president. And on behalf of the Kentucky Realtors, we are honored here to present House Bill 62 to you all. As president of the Kentucky Realtors, I am here to represent over 13,000 Kentuckians who are involved in all aspects of real estate, including residential, commercial, real estate brokers, sales associates, developers, builders, and property managers. Kentucky Realtors support House Bill 62 because it protects the consumer, and we respectfully request your support today. The proposed legislation would actually require, as you just heard, any individual advertising for sale an equitable interest in a contract for the purchase of real property to hold
Ma'am.
an active real estate license and to hold them to the same standards. That's what we are asking.
Ma'am, we have a tradition in this committee that we don't repeat testimony, so Yeah, but thank you thank you. Yeah,
Motion
yeah.
on the bill.
Yeah, I think I heard a motion, had a motion from Senator Thayer. Is there a second? Second from Senator Nemus. Further discussion. I'd like to ask, is there anyone here that wants to speak against this bill? Any questions? Question. Senator Nemus.
Yes, Ms. Monarch, I've been to your auctions before. Would this prohibit me from advertising the house that you're going to auction so I know what I might want to bid for it?
You mean you want to advertise my auction?
Well, the particular property, it would be limited, but I still might want to go through emails or my contacts and per se advertise it to see what someone might pay for it. Then that way, when I go to your auction, I have an idea of what I might want to bid.
Well, sir, we do cooperate with real estate agents. So if you would like to send that to a potential client that you're representing, we do work with you in terms of an auction. But if you were to come and make an offer on my property and my seller was to accept it, and then you want to go out and advertise that without a real estate license to the public, I would say this is exactly what we're trying to stop.
Thank you.
I think if I could add to that, I think I understand what you're asking, Senator Nemus. And I am involved in flipping properties as well myself. And so you're talking about making those personal contacts to someone to say, hey, if I were to buy this property, what would you be willing to pay for it? And I don't think that would be covered under this. That's an individual contact, and you're not actually advertising the property.
Well, Mr. Speaker, I think you brought the best with you. So,
Thank you.
Thank you.
Any other questions or comments? Madam Secretary, call the roll.
Senator Adams. Senator Douglas.
Aye.
Senator Harper Angel. Senator Higdon. Senator Howe.
Explain my vote.
Vote and
I
explain.
vote aye, and thank you for bringing this. This has been an issue in my area quite a bit. And people don't understand what true value is anymore in some of our properties, even without the recent run-up in the real estate market. And it's something that we needed to get into place to protect all parties, and I just appreciate your time on it.
Senator Mays Bledsoe. Senator McDaniel.
Aye.
Senator Nemus.
aye.
Senator Thayer.
Aye.
Senator Thomas. Chairman Schickel.
Aye. Senator Adams, would you like to cast a vote?
I would like to register an aye vote.
Thank you, Senator. We have 10 yeas, no nays, and no passes. House Bill 62 is passed with favorable expression that same should pass.
Motion for consent.
We have a motion to consent. Do I hear a second? Who made the second? Thank you, Senator. All those in favor use voting sign of aye. Aye. Anyone opposed, like sign. The bill will be placed on consent. Congratulations on your testimony and the bill passing out.
Thank you, Mr. Chairman and members of the committee.
Thank you all.
The next item on the agenda is Senate Bill 67. Senate Bill 67 was heard during the interim. It came through this committee and was passed out, and then it was sent back to this committee for today. So that's where we are today. It's an act relating to freestanding birthing centers. The sponsor is Senator Shelley Funky Fromeyer. Welcome, Senator. It's great to have a Northern Kentuckian with us today, and you're no stranger to this committee. I believe you have a sub, don't you?
Yes, sir.
Okay. So at this time, I'll entertain a motion to adopt the sub. Who made that? I believe it was Howe. Howe, and seconded by Senator Adams. Is that correct? Yeah. Okay. Motion been made by Howe, seconded by Senator Adams. All those in favor use the voting sign of aye. Aye. Anyone opposed, like sign. We have adopted the sub. Let the record reflect. Senator, introduce yourself for the record and proceed with your testimony. And I think we probably want an emphasis on what are changed in the sub.
Great.
Thank you, Senator Schickel, and thank you for allowing us to come back and visit with you today. And I also, Shelley Funky Frohmeyer, Senate District 24, Campbell Kenton, Boone, and Bracken County.
I didn't mean to interrupt you, Senator, but I feel compelled to announce this. I am going to start the clock. There's going to be we're going to shoot for 15 minutes, okay? And that includes questions, because I have a long list of people here that want to talk. And then you will have a chance to come back, and we'll go back and forth. But I want to respect everyone's time, so I'm starting the clock now. Go ahead.
Thank you. And Mary Catherine DeLauder is with me as well, the director of the Birthing Coalition, and she won't intend to speak unless you've got some specific questions. We also have the educators from Frontier Nursing University, and we had a guest appearance by a baby as well. So we've got a lot of good stuff for you. So what you'll find in the committee sub, we really tried to address some of the concerns from our hospitals. So you'll see that this is an even more robust bill than what you had the opportunity to view with us a couple weeks back. But to be very clear, freestanding birthing centers are authorized in Kentucky today. In 2017, there were multiple appeals and exhausted the financial resources of a midwife who's no longer here in Kentucky. She could not achieve the opportunity to open her birthing center, but she certainly tried. So what you'll find in the Senate Bill 67 is establishing a waiver of the certificate of need. In Section 1.3, we placed a 4-bed limit requiring that if you have 4 or fewer beds, you could be waived. But if you have 5 or more, you'll be expected to go through the certificate of need process. So that's an addition since we last prepared and brought this to you. This truly is a concession to the Kentucky Hospital Association. The second key action of this bill is to modernize the statutes, including the Cabinet's responsibility to delineate requirements for medical malpractice insurance for freestanding birthing centers. So you'll also see that on number 3. That's even on page 1. Our point is reducing government intervention. We're pushing towards more free enterprise, reducing the cost to families, the cost to insurance companies, and the cost to the state of Kentucky. We want to increase safety. When Jesus was a kid, he had an unconventional birth, but more babies are being born at home than in modern history, including my granddaughter Charlotte Ann. Freestanding birthing centers will give women and families a place for prenatal and perinatal mental health and anxiety attention. It will be much like an outpatient birthing experience. This bill is now 32 pages, as you see. It is really truly to make clear the responsibilities of the birthing centers. You'll see this in Section 3. And then moving into Section 6, you'll see that the additional changes make freestanding birthing center staff required to complete those vital statistics, the documentation for birth certificates, and paternity establishment. The statute makes it more clear that the APRN, nurse midwives, and licensed certified professional midwives complete this documentation. The out-of-hospital births and these professionals will have access to the Kentucky Child Vital Statistics computer system. Again, addressing some of the concerns from the Hospital Association. You'll also see some changes in Section 7 and moving into Section 8 relating to newborn hearing screening. Section 9 is dealing with the screening for heritable and congenital disorders. Section 10 relates to the testing and the information to cytomegalovirus passed in late 2022. So Section 11, that's new. This was not previously in the bill, but it does add freestanding birthing centers to the definition of health facilities. So I think you'll find that we were quite thorough. We took this to another level, but recognizing that we want you to address the statute. We want the cabinet to address the regulations. We were not trying to accomplish all that in this bill. To summarize, 8 out of 50 states do not offer free standing birthing centers. Only 8. Tennessee has 2, West Virginia has 1, Ohio has 3, Indiana has 7. I believe if we're going to achieve our wellness revolution, I really do believe we got to be accountable for ourselves. And freestanding birthing centers are an excellent and perhaps safer alternative to home births. What I'll acknowledge, though, is large studies show that 9 out of 10 women entering birthing centers achieve a vaginal birth. This means that C-section rate is 4 times lower than that seen among low-risk women in Kentucky right now. Perinatal mental health during the prenatal and the postnatal is receiving a much greater priority with the midwifery model. Practitioners visit at a longer length with the mothers, with the family. They are focusing on physical, mental, nutritional. They're looking for the success, but they're also looking for where mom needs improvement. I think that's why you'll see that the outcomes are so excellent and so strong with this midwifery model. The one key item I want to express, there is such a significant rate of adoption for breastfeeding. Why is that? When you have the prolonged skin-to-skin contact that occurs for hours after birth, this truly bonds a family. This is improving the mental, the emotional. This lasts a lifetime. It is scientifically proving that breastfeeding creates and sets up emotional and physical well-being that is not seen without it. Certified nurse practitioners, advanced practice nurses, they are committed to the care with hemorrhaging. We have done much work in the Kentucky legislation to allow them the ability to prescribe and to carry these medications. So it truly addresses some of those emergencies that the Hospital Association is trying to alarm us with. We are addressing this. Our desire is to remove the barriers. These are small businesses. I'm a small business owner. I admire that we are trying to put in place. These professionals are meeting a need. This is a need. Women are in demand of something more affordable, safer than the home birth, and in a way to maximize and optimize their health outcomes. We must turn around from a D in 2019 to an F in 2022 from the March of Dimes report card. This is one method to help achieve that. How can we answer your questions? I would love to see your vote of yes, please.
Well, you did great on time. Thank you for that. And thank you for your testimony. I think we will open it up to questions now if we have any. Senator Nemes?
Yes, you say that 1 in 10 have C-sections at birthing centers, and that's higher at a hospital. Is that correct? And also, is that not because most that think they might need or do need a C-section would go to hospital anyway? So, wouldn't that be kind of a stat that's not really true to true?
So when we talk about, so the C-sections aren't performed at a birth center, but that doesn't mean that someone who came into their birthing process not planning a C-section, but at some point it's determined that maybe they need one, or they transfer to the hospital, and then after they transfer, it's determined they need one. So those people who transfer to the hospital and then have a C-section are still looked at as far as patients as a birth center. So when we look at patients who needed to transfer and then have a C-section, that rate is lower than their counterparts who have similar health profiles, so other low-risk women.
Yes, but it's still convoluted, because if you think you need a C-section or you're going to have a C-section, you would go to the hospital in the first place. So to make the stats correctly, you'd have to say how many women went into a hospital not expecting a C-section, or the chance of it compared to a birthing center would be the proper way. That I just think that you say 1 in 10 compared to whatever a hospital is not quite apples to apples.
Thank you for bringing that up, Senator Nemes. The primary point that we're acknowledging is that the opportunity for a birthing process that allows for low-risk women to have a vaginal delivery. And it is not to we weren't even comparing the two. We were just acknowledging that the amount of 4 and 10, 40% is a very large percentage. And we like to see it a much, much lower percentage than that of C-sections for low-risk women.
Senator Adams?
Yes, I just wanted to ask the sponsor of the bill about working with the Hospital Association, and is that where most of these changes have come from?
Thanks for asking. I have to confess that I'm a freshman, and I was very disappointed in the lack of communication. I received zero communication from the Kentucky Hospital Association. So the changes and adjustments, I did reach out to the president of the St. Elizabeth Hospital Network and requested input.
Senator, I don't mean to interrupt, but I think we need to get them on here in just a minute, and then maybe we'll just go directly with, yeah, they're signed up here. So we'll just get them on and hear right from them.
Sure.
I wanted to recognize Senator Douglas, so first, if you had something just for this lady.
No, Mr. Chairman. If KHA is coming, I'll
Yeah,
hold my
that's what I
questions.
thought, yeah. Okay, let's do that. Let's change gears here. And I'm looking here, and I see the Kentucky Hospital Association has signed up to speak. Why don't you come forward? And then who else wants to speak against this legislation? Got what? Okay, yeah, why don't y'all just come up together? That's fine. If you're opposed to this legislation, why don't you come on up to the table? Have a distinguished looking group of people here. I want to point out, though, I have to point out as chairman, we did have an interim hearing on this that was publicized, and I think people need to know that. But welcome to the committee. I'm going to start the clock for 15 minutes, just like the other side. Don't feel compelled to use all your time. There's no penalty for not using all your time. But we'll start the clock. Introduce yourselves for the record and proceed with your testimony.
Dr. Jody Prather, I'm the Chief Strategy Officer for the Baptist Healthcare System and a family physician. Is that on? Sorry. Dr. Will Milan, I'm currently...
Can't hear you.
How about that? Is that
Now,
better?
yeah, pull it close. Don't be bashful.
It's the first time I've ever been accused of not being loud enough. Will Milan, I'm a family physician. I practiced in a collaborative practice with nurse midwives in Eastern Kentucky for 20 years, and I'm currently the Senior Vice President for Patient Safety and Quality at St. Clair Healthcare in Moorhead.
I'm Dr. Elena Oak. I'm the lead physician of the St. Elizabeth Laborist OB Hospitalist Group in Northern Kentucky. I currently work with 7 certified nurse midwives and a variety of other physicians in Northern Kentucky. Thank you.
I'm Nancy Galvani, President of Kentucky Hospital Association.
Good morning. I'm Dr. Dan Goulson. I'm Chief Medical Officer for CHI St. Joseph Health and an anesthesiologist by background.
I love your white coat. It makes an impression.
Thank you.
Proceed with your testimony.
Thank you, Senator Schickel, for having us today. We did think that our position was well known, and we didn't testify earlier because we thought it was very well known. I know I think, met with Senator Funky Fromeyer in the interim. Some of our advocacy team did and discussed this issue. So we did think that our position was well known, but we want to thank you for hearing us today very much. And we appreciate that it's been pointed out that freestanding birthing centers are allowed to be built in the state. I think there was a misconception that legislation was needed to allow them, but they already can be built under current law. And looking at the record since 1983, 6 applications for a CON for birthing centers were filed with the state, and 3 of those were granted and 3 of those were denied. So it's clear that certificate of needs can be granted for birthing centers when there's basic patient protections built into the plan and there's communication with the local hospitals and physicians. These applications, all that were filed under CON, were examined under the non-substantive review standard, and that standard presumes that the application is needed. and the application is only denied if parties opposing the issuance of the CON can show by clear and convincing evidence that there is not a need. The Cabinet informs us that more than 90% of CON applications filed under non-substantive review are granted. So changing the law and removing the current regulations pose significant issues of patient health and safety, and the CON process is crucial to the health and safety of our patients. And although a CON has been issued for these types of facilities, 3 have been issued, it's telling about their viability in that none have been developed in Kentucky, even though CONs have been granted. Legislators have been told about how good the outcomes are for birthing centers, and they should be, because as it's been pointed out, birthing centers are not supposed to take any patients experiencing or expected to experience any complications. Birthing centers, by definition, are not hospitals. They should never take patients who might have any kind of complication that could endanger the lives of the mother or the baby. Any freestanding birthing center must have the proper oversight by an obstetrician, have standing written transfer agreements with the local ambulance service and the local Kentucky hospital. The proposed legislation and the committee sub to remove freestanding birthing centers from CON would require a change in regulation, removing the requirement for oversight of the facility by an obstetrician with admitting privileges at a local hospital. If a complication during birth arises, a quick transfer from the birthing center to the hospital is going to be critical to the health and life of the mother and child. And without those written transfer agreements in place, a complicated birth could easily lead to the death of the mother, the baby, or both. The proposed legislation and committee substitute does not require such an advanced written transfer agreement with a Kentucky hospital. In fact, the national accreditation standards referred to in the legislation specifically state, and I quote, "A written agreement is not required between birth center and receiving facility. A birth center must only notify the hospital of the impending transfer, the mode of transport, the expected time of arrival, and upon arrival, the birth center and midwife gives a verbal report and a legible copy of relevant prenatal and labor health records." In other states, we have seen that freestanding birthing centers have left a number of dead or injured patients, and there's been little accountability. These operations have difficulty obtaining malpractice insurance, and if an injury or death arises, they have simply declared bankruptcy and walked away. We appreciate that the committee substitute calls for the Cabinet to address requirements for malpractice insurance for the center. However, it is not clear from the language that if the requirement would be extended to the midwives practicing in the center, not just the center, but the midwives practicing in the center, which is crucial to protect patients. It's not also clear whether the committee substitute intends to allow a default to the accreditation standards, which consider a center to be in compliance and accredited without the center or the midwives actually having coverage. The accreditation standards state, and I quote, "If birth center and or clinical providers or clinical staff are not covered by medical liability insurance, clients are notified of this fact." Any legislation seeking to advance the building of freestanding birthing centers should, at a minimum, require the facility to be under the direction of an obstetrician. Both the facility and each clinical provider is fully insured for medical malpractice, and the facility is required to have an active written transfer agreement with the local ambulance service and the local Kentucky hospital. Vanderbilt University Hospital is one of the ones in Tennessee. There's the one in West Virginia is also owned by a hospital. Vanderbilt University Hospital operates a freestanding birthing center within a mile of its hospital in Nashville. It's operated under the direction of an obstetrician. It employs advanced practice nurse midwives, all of whom are credentialed by the Vanderbilt Hospital, and it has the ability to quickly move a problematic birth to the university's hospital. It's not run by non-nurse midwives, as has been proposed here in Kentucky. Hospitals here in Kentucky which offer obstetric services offer a number of options for their patients, including the use of nurse midwives and doulas, and many rural hospitals continue to offer birthing services despite losing money to keep access in the community. Hospitals are not opposed to patients having options, but our first concern is always with the patient's health and safety. Removing freestanding birthing centers from CON would be a misguided step in a state with some of the highest infant and maternal mortality rates in the country. Kentucky's hospitals call on the legislature to maintain the integrity of the CON program for freestanding birthing centers. And while the non-substantive review standard is a very low bar, it is critical for the health, safety, and lives of our patients. And so with me today, I have 4 excellent physicians here that can talk about the patient safety concerns. Dr. Oak, do you want to start?
Sure, thank you. Thank you, and thank you for allowing me to come and speak what I'm most passionate about today. I'm coming to you from the heart of a provider, a physician in the Commonwealth of Kentucky, as well as a patient who has been delivered. All 3 of my babies were born natural childbirth by a nurse midwife.
I just want you have 7 minutes total
Okay.
time left, and I see
Okay.
3 people sitting there. So.
Great. I'll go very quickly. As you can tell, I'm just really passionate about birth in Kentucky. I support freestanding birth centers. I support the midwifery model of care. I do not support an unregulated freestanding birth center. I feel that there needs to be collaboration and oversight by your birthing hospitals, very similar to the Vanderbilt model. My concerns come out of being a physician who is on the receiving end of what is sometimes very unregulated birth. I have big concerns about maternal as well as neonatal safety in this situation. In addition to what's already been presented about the bill, the lack of any regulation of distance from a birthing hospital concerns me. The lack of any oversight of consistently risking out high-risk patients. I know we say low risk for birthing center, but that doesn't always happen. And one of the best examples I can give is the obesity rate that we have that is epidemic in Kentucky among women of childbearing age. And obesity is a risk factor for childbirth. I do want to acknowledge that I realize we have maternity care deserts here in the state of Kentucky. I am a past president of the Kentucky Perinatal Association, which is a collaborative association between nurses, hospital administrators, midwives, social workers, public health experts. And I have worked hard alongside with the March of Dimes to improve that letter D grade. I've been part of a lot of state initiatives. So it's not that I'm anti-midwifery. It's not that I'm anti-birthing center. It's that there needs to be regulation and oversight to ensure that the women of Kentucky are provided safe and compassionate birthing options. I'll leave it at that. I will say I would like to say that I work in a hospital. My babies do skin to skin, and my C-section rate is consistently 10% or less. So I can say from the 9 out of 10 women that achieve vaginal birth, I have those same statistics in a hospital setting.
Our practice in St. Clair has about a 12% primary C-section rate. I want to not repeat because that is your tradition, but ditto. And I want to just show one example of where my concern about patient safety is. Again, I actually believe birthing centers have a role, but the leading cause of maternal death, mother's death in the world in childbirth is bleeding to death. In the United States, that is not true. It was true 100 years ago. My great-grandmother bled to death at home after delivering my great-aunt in the city of New York. So it's a personal thing. As an instructor on advanced life support and obstetrics, which is a patient safety course, we do teach about the management of bleeding after birth, because bleeding after birth cannot be predicted. It has to be expected with every delivery. And although many cases can be managed right away through good technique and medication. The worst cases, and that's what you guys have to think about. I do know that this is something that we don't want to be scaring anybody. However, you have to think about the women who need blood and need immediate treatment in a resuscitation environment and need shock treatment for hemorrhage. And so my thing is I want to make sure these birthing centers have close relationships, that you have a highly functioning, advanced EMS system that can manage that. So something in an urban environment is probably reasonable. Sandy Hook in Elliott County, Kentucky, it's not going to happen. It's not personal. I've been their director. I'm just telling you. It's a 45-minute drive to the hospital. They're going to die. The leading cause of maternal death in this state is substance use. It is not currently bleeding to death. I don't want to contribute to that number. All three of my kids also were midwife deliveries. Thank you very much for allowing us a chance to talk to you today.
I appreciate the opportunity as well. Again, my microphone wasn't on. Dr. Jody Prather from Baptist Health, and I'm a family physician. I'll be brief because I know we're short on time. Our physicians here gave us a good clinical picture. I'll come more from being the strategy officer who's in charge of a lot of the processes around transfers and handoffs and continuums of care for our 9 hospitals, which is we deliver more babies than anyone else in the Commonwealth. And we're not saying birthing centers are inappropriate. What we're saying is transfers and handoffs of patients is extremely complicated and extremely at risk. And I've worked with some of you all on some of our EMS challenges. Think about the concept of when something's going wrong, if the processes are not in place from the handoff to the physician to the EMS to making sure that those overtaxed services are ready and that the handoff to the physician and the hospital is so good. I spend most of my time making sure even inside of our walls that the right handoffs and continuum of care happen with patients. And there are still risk points, and we practice it every day. And the chance that a non-regulated facility could be set up with the risk associated with childbirth, and then the expectation that just somehow that transition is going to happen in the best interest of the child and the mother, to me, is a very dangerous proposition. And that's all I would add to the conversation.
Good morning, Dr. Dan Goulson, CHI St. Joseph Health. Just to elaborate on a couple of points that my colleagues have made, when risk can be predicted, it's very easy to manage that. And certainly in this model, in high-risk cases, those would be routed to appropriate centers and appropriate levels of care. Sometimes risk can't be predicted. And we had a discussion from Dr. Milan about hemorrhage.
Excuse me, doctor. The time is up. However, this is important testimony. I just want to reiterate as chairman, that we should have heard this during the interim. In this committee, when something goes on the interim agenda, we're serious about it. We don't hear any bills unless they've been heard during session. But out of respect for this important testimony, I'm going to put some more time on the clock because I think we do, at least I want to hear all the testimony. So I'm going to go ahead and put 10 more minutes on the clock. Thank you, Doctor.
Thank you, Mr. Chairman. In the case of hemorrhage, one of the conditions that leads to maternal hemorrhage is a condition called placental abruption. And the abruption word is not a coincidence because it happens abruptly. It happens without warning, and it's life-threatening. In hospitals, you may be familiar that we have techniques to rally all hands on deck. And so if there's a fire, we call a code red. If there's a cardiac arrest, we call a code blue. In many hospitals, when there's a maternal or a neonatal emergency, we call a code green because it's necessary due to the condition and the situation for all hands on deck to come immediately. If a patient in this instance of a freestanding birthing center is miles away from a hospital, I think that we all know, just practically speaking, the degree of response is going to be much delayed from those that are inside a hospital. So in many situations, we identify need for health interventions. We identify need for health and medical services, and that need is really operationalized by the Certificate of Need program. And so if there is a need in a community, in a care desert, then it may be appropriate to have these types of facilities. But because the risk is significant and the risk can lead to both maternal and to neonatal death, I would ask that we maintain the integrity of the Certificate of Need program and recognize that if a higher level of care is available, it should be made available.
Thank you, Doctor.
Thank
and
you.
I'm sure we're going to have some questions. Who has questions? Senator Dr. Douglas, go ahead.
Thank you, Mr. Chairman. We have, I don't have a lot of questions. I think you guys, I want to thank you for coming. I want to thank everyone who has spoken this morning. I think you gave some very valuable, you've each given very valuable information. As a senator sitting up here and as a practicing physician for more years than I'm going to share, I see this bill in two different parts. I see this as a bill about freestanding birthing centers and a bill about certificate of need. And I'm not going to address that divergence, but I just wanted to put that out there. 4 things, if I may, Mr. Chair, and I'll say them very quickly.
You may proceed.
Thank you, Mr. Chair. First of all, birthing centers, we look at birthing centers to cut costs. I love to cut costs. Anyone who knows me here in the Senate knows I want to cut costs because I want our taxpayers in the Commonwealth of Kentucky to stop carrying all that burden. That is, those who are producing income, but not at the cost of lives. And anyone who's sitting in that chair, especially the physicians, know it's a scary place to be. Medicine's a lot of fun, but it's a scary place to be at times. Number 2, there is a lack of awareness. I worked as an emergency room physician for 4 years, Mr. Chair. It's scary as hell to get these calls in the emergency room when the information is not accurate. Number 3, we're talking about mothers and sometimes 1 to 2 other persons. They need immediate care. This isn't like cutting your finger in the backyard. Kids die. And number 4, we can sit and talk about things not being an emergency all we want, but it's not an emergency until it is. And then when you find at least the doc finds his or her heart in their throat because they're trying to figure out things that they're going to do during the transport process and they have no idea what's going to what's going to come in that door, Mr. Chairman. I can't explain to you what that is like. I think the concept in this bill is a really good one, but I do think we still have work to be done. Thank you, Mr. Chair.
You're welcome. Senator Thayer.
Thank you, Mr. Chairman. I'm really conflicted on this bill and where we are. Full disclosure, I'm the one who suggested to Senator Funky Fromeyer that we send this bill back to committee and work on a committee sub with the 4-bed limit and some of the elements of the floor amendments that were filed. And she's done that. And by the way, she's doing a great job working this bill and her bills. But I'm conflicted because the KHA appears to continue to be opposed to it. And I do want to throw this suggestion out there. It's very likely that we're going to have a task force or a working group or 1 or 2 committee meetings dedicated to the certificate of need issue this summer. Several legislators in other bills have brought up CON. Those bills are not moving forward this session, but I do think it has prompted the likelihood that there will be a full-on discussion about CON during the interim. And I think the main issue I have with this bill is the camel's nose under the tent as it relates to CON. So I just wanted to throw that out there, Mr. Chairman. I do know that this bill has been fully vetted, but I would like to say to my friends at the KHA, get in the game earlier. Don't wait till bills have passed committee before you start blowing up our phones with text messages saying that you're opposed to it. Don't rely on 1 or 2 of us in Senate leadership to kill the bills you hate. You got to engage earlier. Thank you, Mr. Chairman.
Ditto. Couple of things I want to say as chairman of the committee. First of all, when a bill comes back to committee, that doesn't bother me a bit. I think that's part of the committee process. I would much rather do it that way than work it out on the Senate floor, work it out in caucus. So that's part of the committee process. I welcome committees back but I do. But I would have liked to have seen you all engaged earlier. Is there anyone else? I'm going to see if we have a motion. First of all, is there a motion on the committee sub? We have a motion by Senator Adam, a second by Senator Nemes. So let the record reflect that we do have a motion and a second. Anyone else have questions of this group? Yes, we did adopt the sub. That was the first thing. I'm going to let, since this group got plenty of leeway on the time, and the other side did ask to be able to do a rebut. I think that's only fair since they only used a fraction of their time and they were here during the interim. So I'm going to ask the other group to come up for rebuttal. And you need to keep it strictly to rebuttal. Okay, we got some new players, it looks like. I wasn't anticipating that.
Whoa.
So I want to emphasize, this is rebuttal.
Yes.
This isn't a presentation, this is rebuttal.
I'm Mary Catherine DeLoder with the Kentucky Birth Coalition, have spoken to you all before. Some of these ladies are faculty at Frontier Nursing University, and they teach classes that deal with things like hemorrhage. So they are the experts, which is why I asked them to be here today to answer any questions related to that. I want to start off by saying that certificate of need is really not about safety. That's what the licensure portion of this is about. Birth centers are already permitted in Kentucky. To say that we're going to have unregulated birth centers, as was stated several times by the folks at the table before us, that's just not true. They're already regulated in Kentucky, and we're actually asking for more regulation by increasing the licensure requirements. Of all those CON applications since the 1980s, there have been none of those successful in the last 20 years. The only one of those that opened was the one from the 80s in 1983. So to talk about things that
we're clear on
20
that.
years ago, not necessarily. So CON is sometimes called the competitor's veto, and I think we can see that the hospitals are very opposed to this, and they don't want to lose their opportunity to veto that. These same licensed midwives are already practicing in Kentucky in the home setting. They are practicing without oversight of physicians. They don't have transfer agreements, but they have appropriate transfers. They have appropriate relationships that they establish interprofessionally with other maternity care providers. We're simply asking for them to be able to do it at one address instead of at my home address.
That's point number 2.
The malpractice requirements, we did add some language regarding that in the sub, as Senator Fromeyer referenced. I would point out that there, as far as I can tell, and no one has corrected me on this, there are no malpractice limitations or requirements on any provider types in statute. It's a common misconception that physicians are required by law to carry malpractice insurance, and we discovered that that is not true when we were doing the licensing of the certified professional midwives a few years ago. They carry it for other reasons, for example, to participate in Medicaid or to accept private insurance, or because it's required by the policy of the hospital where they work, but the state does not require that by law. And I'm not aware of any statutes that require any other facility types to carry any malpractice insurance. Yet we have added language that will direct the regulations to address this. We do only have 20 of the birthing hospitals in Kentucky that offer nurse midwives who have privileges to actually deliver babies in the hospital. So while, yes, we do have some midwifery services in the hospital, it is very limited. Regarding the distance requirement to a hospital, I don't quite understand because there were separate floor amendments filed on this, and I assume KHA asked for those floor amendments, but again, they didn't come and talk to us or Senator Fromeyer, so we just assumed that maybe they had asked for those floor amendments. There's one floor amendment that requires a birth center to be within 5 miles. There's another floor amendment that says a birth center cannot be within 60-minute ambulance ride. So one says it must be close, one says it must be far away. I don't know if it's a drafting error because no one proofread the amendments, but I'm not sure what we're looking for there because there's two different floor amendments on that. And as far as addressing emergencies like hemorrhage, I'm going to let either of you address
Very well.
how that would be handled.
Introduce yourself for the record and proceed with your testimony. No repeat.
I'm Dr. Dee Polito. I am faculty at Frontier Nursing University with 26 years of experience as a certified nurse midwife. I would just testify that we are in agreement with many testimonies about safety, and we fully recognize that complications can and do occur not only in birth centers but in homes, but they also occur in hospitals as well. So we're just asking for the separation of the issue of CON requirement because those 6 applications for CON for birth center care resulted in no birth centers opening in Kentucky, allowing that to have a significant impact on the care that patients are able to get in Kentucky.
Thank you. I'm always curious, what kind of doctor are you?
I have a doctorate in nursing practice.
So you're a physician?
I am a doctorate of nursing practice.
Okay.
I've achieved
Thank
the
you.
highest level of
Okay, so the answer,
education a nurse can achieve.
Okay, thank you.
Hi.
Hi, well, introduce yourself for the record and proceed with your testimony.
Good
Welcome.
morning. Hi, I'm Victoria Burslem. I'm a certified nurse midwife, and I teach at Frontier Nursing University. I've been a midwife for over 40 years. I was a practice manager at a very large OBGYN hospital in Atlanta. We had 10 midwives and 11 physicians. I've also practiced and gave birth at a birth center, worked for 3 years in Delaware. So I speak from the perspective of safety, and I can't agree more with what the physicians alluded to. What I would refer you to rather than anecdotal fear is, what does the research say? We have a SMART study. We have a study that we have tried to distribute to people from the Journal of New England, the New England Journal of Medicine, validating the safety of birth centers. I agree wholeheartedly that CON process does not address the safety issues that we're talking about. Hospitals are the place that you're going to be referring people for if they need a C-section, if they need high-risk care, if they need GYN surgery. Those are all going to go to those hospitals. What we see, the rationale that's being used is this competitor point that's trying to say that we're going to be in competition with hospitals, and that's not the case. You have to work in collaboration with physicians and with hospitals to be safe. The CON process does not address that.
Thank you. Well, thank you all. Any questions of this group? I think we'll go ahead and vote. Does anyone have objections or want to ask something else? I think we have some pretty good dialogue here. Madam Secretary, call the roll.
Senator Adams.
I'd like to explain my aye vote.
Vote and explain.
I'm going to vote aye because I have a tremendous amount of respect for the sponsor of this bill and her partners that she's been working with. I've worked with on numerous issues, and so I think they bring a tremendous perspective. We wouldn't be up here if this perspective didn't need to be identified as an option for birthing in Kentucky. With that being said, it's also a heavy lift when the Hospital Association comes out against it. So I'm voting yes, but I do think that the conversation will need to continue, and I do think that there are areas that maybe we can find some consensus on, and so I would like to help in any way I can with promoting this as we move forward.
Senator Douglas.
Vote and then explain my bill, Mr.
Vote and
Chairman.
explain.
I'm going to pass on this because I don't necessarily want to kill it. But this is not a competitor bill. We've got this idea in our society that if somebody wants to do something that we do, that everyone gets upset and throws up their arms, and all of a sudden it's a competitor bill. We have to move away from that, Mr. Chairman. People in healthcare, that is physicians, look at things differently than a lot of the regular population. Not a criticism, just an observation. Thank you, Mr. Chair.
Senator Harper Angel.
explain my vote, Mr. Chairman.
Vote and explain.
I vote aye, and I want to thank Senator Funky Fromeyer for bringing the legislation. She has worked very, very hard on it. We've had 2 late-night conversations that I appreciate her reaching out to me, and I vote aye. Thank you.
Senator Higdon. Senator Howell.
Aye.
Senator Mays Bledsoe.
Vote and explain.
So I too am very conflicted about this bill. And I say that since I'm very new to the issue. And I very much respect what Frontier is doing, and I want to be a strong supporter of your success. I think having a center on there is really important, and I'm for it. And I voted to support it the last time this came out of committee. And I want to thank Senator Fromeyer as well, because I think the sub is a much better.
I'm sorry, but go ahead and vote. We
Oh.
vote first and we explain. That's my fault.
I'm voting no. And I'm saying that only because I don't feel 100% confident yet to say yes, given the concerns I've had from other people in the district who've reached out. And I'm just not ready for it. And that's why I'm voting no. I want to find a way to get to yes, and I'm committed to doing that in the interim. Thank you.
Senator McDaniel.
No.
Senator Nemus.
I'd like to explain my aye vote.
Vote and explain.
Aye. I consider this as nothing to do with CON. That's a different issue that we'll take up later. I think it's a freedom of choice as long as you know the safety issues of it, because it isn't as safe as a hospital because of the transfer in it. I am a little concerned about the liability that the hospital is going to have to pick up when they pick up the problems, all the problems that they would have there if there weren't birthing centers. But I'm voting yes because I think it's a freedom of the choice of the woman.
Senator Thayer.
Explain my vote, Mr. Chairman.
Vote and explain.
I'm going to vote no because I just don't think this issue is ripe yet. And I'll be honest, I don't think we have the votes to pass it on the floor. I voted yes last time to get it out of committee, and I suggested to Senator Funky Fromeyer that she take this path, and she's done an excellent job moving the issue forward. But and the committee sub is good, and it moves it in the right direction. But I think I would be disingenuous knowing that we're probably going to take a deep dive into this issue during the interim. It's going to get out of committee today, so I'm going to vote no because I just don't think it's ready for prime time yet.
Senator Thomas.
Mr. Chair, I'd like to explain my aye vote.
Explain.
Thank you. I believe in our free market system here in the economy that there ought to be good competition, fair competition for services, for goods. And I think that's also true when it comes to birthing. We all have to acknowledge that birthing is inherently risky. What's been testified here today that you could have what's deemed to be a safe birth and something go wrong is certainly true. I mean, birthing has its risks. We all know that. However, we have to also acknowledge that most people who are born in this world are born outside of a hospital. Now, that wasn't true in my case with my 3 children, but most births take place outside the hospital, and we can see from looking at the world that that's okay. Kentucky does have one of the highest infant mortality rates in the state. We're at the bottom, and Dr. Douglas has pointed out that that's largely due to substance abuse, and that could be true. But we have that. We don't know where these birthing centers will add to that problem or correct that problem, but I'm certainly willing to give it a try. I guess what makes me want to say a yes is that 42 states already do this. And not one of them have said this was a bad idea and have reversed course. So we know it works here in the country. I just hate it when Kentucky's always bring up the rear rather than leading. I like to see Kentucky lead. This is my home state. I grew up here. And yet we're one of the last states to go down this path. But I think we got to go down this path. It's working in other states. It'll work here. So for all of those reasons, Mr. Chair, I vote yes on this measure.
Thank you.
Chairman Schickel.
I vote aye. We have 7 yeas, 3 nays, and 1 pass. Senate Bill 67, as amended by Committee Substitute Number 1, is passed with favorable expression that same should pass. Congratulations. And I want to thank everyone here for this hearing and the decorum that's been expressed. I think we've had a good hearing. If there's any objections, does any member have anything they want to add before we adjourn? Without objection, we stand adjourned.